My name is Hannah, and I am a co-leader of Student Congress. So the Teacher Talk series is brought to you by Student Congress, and Student Congress is a student-led organization, and we do advocacy and other work. We have 4 committees. We have the Academic Development Committee, we have the Communications Committee, the IDEA Committee, and Student Engagement Committee. If anybody has any questions about Student Congress or is interested to get involved, I will put our email in the chat box and you can feel free to reach out to us. This presentation is being recorded, so if anybody wants to participate, but participate anonymously, feel free to turn your video off, and you can still participate in the chat box as well and ask any questions throughout. I'm going to pass it off to Shadiqua, who is the other co-lead of Student Congress. She will be facilitating today's Teacher Talk series. Thanks for coming, everyone.
All right, like Hannah said, my name is Shadiqua, and I'm also a co-leader of Student Congress. Very happy to have Professor Alicia Wilson here to discuss the role of school social workers and just a little bit about the field in general. So before we get to her presentation, it's about 10 minutes. And then after that, I'm gonna ask like a few follow-up questions and then open it up for the general audience to do Q&A. And before we do that, I'm just gonna tell you a little bit more about her. Alicia Wilson is the Regional Social Worker Supervisor for NYC Public Schools and a college professor. 18 years ago, she began as a mental health clinician for NYC Juvenile Detention Centers and later became a founding social worker at an alternative high school before her promotion to Director of Student Services. In these roles, Alicia examined the impact of arrest and court involvement on youth social, emotional, and academic development using a trauma-informed lens. She developed an evidence-based training curriculum to address disproportionate minority contact with the juvenile justice system and the underutilization of mental health resources for minorities in NYC Public Schools. Alicia recently completed her doctoral classes at Adelphi University School of Social Work and is working on her dissertation around the impact of RTI MTSS on minority students. So thank you, Professor Wilson, for speaking today. She's my professor for school social work, so I'm just really excited that she was able to come and discuss the field with everyone.
Thank you, everyone. Thank you, Shadiqua, for that beautiful opening. I really appreciate being here. It's always great to connect with current and future colleagues. You know, the field needs you. As you see, for more than a decade, mental health was not really talked about. In fact, it was an embarrassment to say that I had a therapist. Many people would not connect and really openly talk about their emotions or talk about their feelings outside of someone that they may be personally connected with. And for those reasons, we haven't always had this big talk about mental health or even what it really looks like inside of the school system. And with everything that's happening in our society, you know, one of the positives, if there can be a positive in what's happening in our world, is that there has been a bigger push towards talking about mental health and what does mental health look like. As adults, you know, for us, we have more emotional language where we can say, you know what, I think I need help. I think I need to talk to someone. But many times our students, and when I say students, I'm referring to children in K to 12 grade. So that's about 5 years old up until 18, sometimes 19, sometimes don't have the verbal language to say, I think I need to talk to someone. I have a problem that I can't really handle. But through either behavior, emotional, or academics, we normally will get them to say something's going on and I need to talk about it. And unless a family is open to allowing their children to go to a therapist, schools is the universal place where children are always going to be And it's our first outlet, our first opportunity to embrace young people, connect with them and kind of say, what's going on? How can I support you? So when we talk about the role of school social workers wear many hats. And a lot of people think if I'm a school social worker, I'm just connected with the school, which means I'm just connected with the student. But in actuality, you are connecting with the student, you're connecting with the student's family, and you're connecting with the community, because we all know from going to our social work classes, you cannot deal with the family in a bubble. You have to deal with all of the environmental stressors. And when we're talking about the school, that means I have to deal with what's going on in their homes, what's going on in their neighborhood. Are there resources in the community? Can I connect with those resources to support this family? So what does that look like? So today, I wanted to use maybe about 10 or so minutes to give you an overview of the life of a school social worker, and then get rid of the PowerPoint and allow us to have an open dialogue where you can ask me questions and I can really share with you some more in-depth insight into what it is to be a school social worker. So thank you again for inviting me. I really want to start, as I said before, students come into the school, and when they come into a school, I would say even up to 5 years ago, there was this expectation that when you walk through the doors of the school, we expect that students are going to drop all of their issues at the door, right? Like you take off your coat and you go in and you just do all of your academic needs and kind of forget what's happening around you. But as we all know about trauma, children and even us as adults can't just drop our life problems and our stresses and just focus on academics. So when we started to look at what trauma looks like for our children, many of you have heard maybe in the last 3 years, we really started to talk about ACEs. And ACEs is what we call adverse childhood experiences. And these are many of the traumas that our young people may experience, from child abuse to sexual abuse, to being in a home where there's violence, being in a home where maybe they have been evicted and living in a shelter, going through the process of losing a loved one and having to grieve, and really realizing that when we connect with kids, we really have to ensure that we are doing holistic treatment. So we're not just treating the child academically, but we're also treating all the events that are happening around them. And when we started to do research, we realized that if you think about a classroom of 30, normally only about 6 students probably have not experienced any trauma or adverse childhood experiences. Majority of the class is dealing with some type of socio-emotional crisis that they can't just turn off when they are working academically. So if we want to ensure that students are successful, how are we actually addressing those issues on a day-to-day basis, Monday through Friday from 8 to 4? And then what does that look like in terms of resources that we are going to provide that student and their family for after school hours and on the weekends? So I really wanted to start by giving you this poem by Joshua Dickerson, which I think is so important to really understand what social workers do as a whole, but particularly a school social worker. And it's titled, "'Cause I Ain't Got a Pencil." I woke myself up because we ain't got an alarm. I dug in the dirty clothes basket because ain't nobody washed my uniform. I brushed my hair and teeth in the dark because the lights ain't on. Even got my baby sister ready because my mama wasn't home. Got us both to school on time to eat us a good breakfast. Then when I got to class, the teacher fussed because I ain't got a pencil. And what ends up happening is this child is removed from the classroom, probably sent to the dean's office, maybe gets a detention, maybe may even get a suspension if he throws a tantrum because he doesn't understand why he's being moved out of the class. And a lot of times our educators, which I think is so important, and I want to say, our teachers and our administrators, when they are going to get their educational degree, if they are doing anywhere from 64 to about 80 credits, they only get 6 credits on mental health. that means only 2 classes. And if they are our frontline workers, the first people that normally are going to interact with a student before the social worker, they should understand trauma and mental health. Because if you look at this poem and say this is real life, and I can tell you many children that fall into this poem, a lot of time, staff members, teachers, and administrators don't think to ask, well, what happened in your day? What's going on that may have caused you to be so emotional in class, to have a temper tantrum, to come into class and put your head down? Many times we look at them and we just say they're lazy or they're just inept, and we don't really know the environmental stressors. So it is the expectation of the school social worker to come in and say, well, let me look at what's happening in this child's life to determine if these behaviors are appropriate and what do we need to put in place, one prevention to intervention to support this child so we can reduce the amount of kids that are suspended or expelled from school, right? Because right now, when we think about school-aged children, suicide is the second leading cause of death for our young people. And since the pandemic, we can tell you that there has unfortunately been an increase that we know this for of 61% of our young people between the ages of 10 years old, which is the youngest, up until the age of 18 that have committed suicide in the last year. So it goes to show our young people are dealing with some type of mental health issues, but are we acknowledging them? So when you think about a school social worker, there are 3 types of students. And it's your expectation to have, like what I say, your trauma lenses on, to really look and observe young people and determine who are the students that may need my support. And one of the hardest things why I say it's so important that every one of you are doing this work, whether you decide to become a school social worker or just a social worker in general. Many of you, if you've ever connected with private agencies that do therapy, you'll find that when you call to do a referral, many of them say they don't have the capacity to take on a new client. Or they say, you know, I'm so sorry that you're experiencing these issues. We can probably get somebody in 30 days. If I have a real crisis, I can't wait 30 days, right? Same for schools. One of the biggest issues right now, which is why I'm so excited to see another graduating class, I'm hoping many people will tag on to be a school social worker, is typically you have one school social worker for 250 students, right? So when I first started in the school system, I worked in an alternative high school. So these were young people who just came out of incarceration on house arrest, had some type of run-in and a record with the law. And I was the only social worker for 200 students and expected to see a caseload of 75 mandated kids and then at-risk kids. There's no way that one social worker can do that. So the school system is starting to realize that they need to have more than one social worker within the school, more than one guidance counselor, to really ensure that we are providing the services that's beneficial to our young people. So in a nutshell, there are 3 types of students that a school social worker is going to experience on a day-to-day basis. The mandated student, and the mandated student is the student that has an IEP that says that they have some form of disability. And this is a legal document that says you are mandated to pick up this child 1 or 2 times a week to provide counseling. The expectation is that you're going to use what we call multi-tier systems of support. And this is a tier system that many of you have learned, where we go in and we do observations of this young person within their classroom and social settings, so lunch and gym, to really understand what are their behaviors, how are they functioning, and then we'll do an FBA, which is a functional behavior assessment. So that's about a 14-page document where you are assessing what are the behaviors, what are some of the issues, where areas of growth for that young person, what are strengths that this student has, and we create a plan to really support this child throughout their time within our school. And then really providing counseling and maybe a behavior intervention plan if that child has behavior issues. So that's the mandated student. Every school social worker is always going to get a counseling roster of kids that have an IEP that are mandated for services. And then you have your at-risk students. These are students that present in some way behaviorally, physically, academically, they are just not doing well. And we want to find out why are they not progressing, as well as their counterparts. Maybe they have a discipline issue, so they've been suspended lots of times. These are young people that are going to be referred to maybe by their guardian, so a parent, by school staff, such as a teacher, a dean, or administrator, or if they're middle school and high school, they may refer themselves. And then you yourself or child welfare, because you're coming from different states. Child welfare could be done in New Jersey or ACS in New York. But whatever your child welfare system is may come in and say, this child needs some type of counseling within the school. And then I like to talk about the under the radar student. This is the student that for the most part, they really are like 50-50. You know, they're somewhat passing their classes. So they're like the C's and D's. They don't really get into trouble. They're for the most part pleasant, but they're going through issues. But because they're under the radar, nobody notices them until something happens, like an attempted suicide. They start cutting. Someone says, I think this young person is depressed. How are we making sure that we provide supports for all three of these students, three types of students, and really give them the help that they need? So when we think about the role of the social worker, there are 6 pillars that I like to refer to. These are the 6 pillars that we do on a day-to-day basis to make sure that we are doing our job. Related services is our first, and I'll break these down in the last 3 slides that I have. Services to students, services to parents and families, services to your colleagues, so school staff, and then how you being a liaison between the community and the school, and then how you service in the district. So the next week, I'll break down all of these types of services. And these are the job duties that you would have on a day-to-day basis as a school social worker. So the first is related services, and this is the expectation that you're going to go in and you're going to provide at-risk counseling to as many students as you can fit on your roster that are either mandated or referred to you. Your job is to actually create some type of intervention strategies that these students can use both in the classroom and outside of the classroom to help them both be academically successful, but also socio-emotionally successful. And then really working to connect the family with outside resources to support them in any way. And then in terms of counseling, many students have asked, well, as a school counselor, what kind of services do I provide in counseling? Each school is different, and it really depends on the needs of your young people. But typical school social workers will provide social skill training to their students. Divorce, like if you have a group of young people experiencing divorce amongst their families and trying to deal with separation and loss, you know, doing maybe a group session with several of those young people that fall into that category. You're going to do a lot of conflict and anger management, right? So how do I deal with my temper? How do I deal with if I'm being bullied so I don't get suspended and I'm handling it appropriately? Middle school and high school, you're definitely going to deal with substance abuse. You're also going to deal with relationship building, figuring out who I am, dealing with the on and off friends and just social skills in that sense. And then a lot of grief therapy. And I would say that we've always experienced grief therapy, whether the loss of a student due to suicide, gang issues, or just medical deaths, as well as now with this pandemic, dealing with the grief of losing family members at such a high rate or a loved one. So those are 2 of the biggest services that you're going to provide, I would say 60% of the time as a school social worker. On the other end, and this is maybe should be more, but typically it's like 20% because trying to connect with families and families really wanting to build a relationship with the school social worker. School social workers should be working hand in hand with the parent. Why? Because whatever you are teaching that child, the goal is that when they go home, the parent is reinforcing it. If you don't do that, then what will happen is that child is going to lose that when they go home. And then every day you find yourself trying to rebuild that over and over again. So the goal is really to align with the family and say, this is the plan for the student. How do you feel about this? How can I get buy-in from you? How can I get you to work with me so it doesn't feel like I'm working against you, especially for families that are concerned that the school may want to call child welfare. How we providing a system where we're not calling child welfare on our families, but really providing the supports that they need, right? And when you're providing those needs to the families, you also need to think about the school staff. Teachers are going to be in the classroom 8 hours of a day, 5 days out of a week with that child. And if I just said to you in my intro, they're only getting 6 credits on mental health, they really need support on how do I deal with this child who is like an emotional roller coaster, the child that doesn't want to connect with me, the child that comes in and doesn't have a book bag and pencil and says, Miss, my life is rough. I don't care about your math test, right? Do the math test yourself. How do we even help teachers to respond to that and to really support them? And this is where many times social workers will push into the classroom. They do observations and model for the teacher how to create a plan to work with this kid. And that could be an incentive. If you're able to X, Y, and Z by a certain period, so we create a SMART goal. The teacher is involved in that SMART goal and the student is involved in that SMART goal. And even if you're thinking about a 6-year-old, we still try to incorporate them into that and say, so this is the plan for you. And then we help the teacher through training, modeling, and observation to really get them to feel supported to do the work and not become so dependent on us. When we don't do training and when we don't assist teachers, what's going to happen is every time you turn around, a teacher's calling you to leave your office or to leave your session to come and support them in the classroom. And if you're not available, what ends up happening is that young child, unfortunately, gets thrown out of the classroom. And then that's just a domino effect from detention to suspension to I hate school to academic failure to I'm dropping out. Right? And if we want to reduce all of these 5 things, the main person in the middle is the school social worker who really does wear 101% of the time that advocacy hat that says, I am your colleague, but I also need to advocate for this student whose voice is often silent because they are the student. And there's that empower imbalance, right? Where the teaching staff has the power and the student feels like, well, no one's listening to me. So you know what? I'm just gonna remove myself out and I become disinterested in school. Many times it is the school social worker that has that undeniable bond with the student, right? And it's your job to kind of help that student to start to have those bonds with other staff members and work with those staff members to really feel like they're connecting. And then the last one is really, okay, so you're doing all this great stuff with your students in the school, but you're only one social worker and you don't have the capacity to see every student. And there are some students that you may see, they actually need more than me, right? They actually need more supports. Like, for example, I don't know, I think I might have my PowerPoint on a timer, sorry. It helps to keep me because you guys will notice I can talk and talk. But what you will notice is many times our communities lack resources and families don't know where to go. They may feel fearful to go. I'm undocumented. I don't want to go to this place and they ask me for insurance. And then I have to tell them I'm undocumented. All of a sudden, I'm kicked out of this country, or I don't want child welfare to be involved. So a lot of times school social workers would do that outreach by one, reaching out into the community within the zip code of where that family lives, find out what resources are there, reach out and say, hey, do you have availability? I have a family that I think would really do great from your services. Beautiful. Can I connect you and the family together? And we either do this by phone. Sometimes you may actually go with a family during school hours to do this connection. And then we kind of hand them off to someone that may be able to provide more resources. And if I was to give you an example, thinking of a student that may be suicidal. If I have a student that's suicidal, as a school social worker, I may create a safety plan and say, these are all the things that you should do when you're not in school and in school to ensure you don't harm yourself. But I'm also connecting with the family, and I'm learning that this family is very religious and they feel like, you know what, all we need to do is pray. We're going to be fine. Our child doesn't need to go to outside resources. But I'm fearful that if this family doesn't take it serious, this child may take it one step further. So my goal at this point, because I don't want to automatically call child welfare on this family, is really feel how can I connect them? What are some of their worries? What are some of the things that they think may happen if they do this connection? And see if I can really support them to build that bridge between the school, the family, and the community. And then it becomes broader, right? Where as a social worker, you are asked to create programs. And I'll give you a prime example. Right now, I am the New York City Social Worker Supervisor. So I supervise school social workers throughout the Brooklyn district. And when this pandemic happened, they wanted to know, well, how do we do counseling virtually? What does that look like? How do we assess students for abuse if they don't have their camera on? And myself and school social workers had to create a plan of how we were going to provide services to our families and our children, and what training did we think our teachers need before we started back school this school year in the midst of a pandemic. So what did that look like? One, doing training with teachers around understanding grief, the 5 stages of grief, which you guys already know, Kubler-Ross, right? How do you identify grief? What support do you provide a student, either virtually or hybrid, if the student's coming into the classroom? Helping teachers, how do you cope yourself if you're going through your own emotional issues and need to be able to balance and juggle that? And then what services do we provide the student? And even in the midst of the pandemic and pre-pandemic, realizing there are times where you may ask to come on after hours because something happened with a child. Unfortunately, a child died in the evening, and a principal may call you and say, you know, hey, Ms. Wilson, unfortunately, we just lost a student. Can you help me create a plan of how we're going to let teachers know in the morning? And then how do we connect with students and inform them that a child has been lost, and then heal as a whole community? So you're going to find in every school, a social worker is a huge part of the leadership team and really developing plans to support our students. And it wasn't always like that. And you're not going to go into school where it's 100% where every administrator is going to say, I know what my social worker does. But as long as you're advocating, you're able to really push forward and really show what the goal is to really support your kids. And I just want to show you what that looks like. Many times without a social worker in the school, many of our administrators have their, I like to say, their trauma glasses off, right? And when their trauma glasses are off, they'll look at a student as to your left, manipulative, lazy, resistant, unmotivated. But when a social worker is there and a social worker is able to train and show them, this is what it should look like when you put on your trauma glasses. So it's not that this child is lazy, but they are overwhelmed because they've just been evicted from their home. It really changes the dialogue, and it really changes how the school will support the family. If we don't do this as school social workers, this is what happens in our schools, where social workers are not a main part of creating the plan. Unfortunately, our children drop out, our children are kicked out of school, child welfare is called to pick them up, or they're being arrested and they're going into the criminal justice system, or there's another family who's there, which is normally a gang, to say, hey, we'll take you in. So how are we building relationships with our young people to really get them to a place where they're like, I love being in school. And I do have someone that is willing to hear my voice, willing to hear my issues and help me solve. And that in a nutshell is truly the role of a school social worker. And like I said, I didn't want to do a whole PowerPoint the entire time. I really wanted to utilize this time to have you ask me questions that maybe I'm not thinking about after giving you just a whole basis of what it is to be a school social worker. So what I'll do is, I don't know, maybe I'll turn it over to Shadiqa, and then you can tell me how you want to do the open forum for asking questions. And I'm even willing to answer questions around how do you get a job as a school social worker as well.
Thank you so much. That was like really helpful, very insightful. So I'm going to ask a few questions, and everyone else, you can raise your hand or type your questions in the chat and we'll get to them. So while you're thinking about those, I'll ask another question and we'll go from there. Something that really stood out for me was the increase within the last year of suicide from like these kids. So you mentioned it before, but what are some best practices for reaching out to kids while in an online environment?
Oh, that's an amazing question, and one that I'm going to say we are still developing. But what I can tell you, what we've been doing is for our young people who are virtual, many times a child that's in crisis will, if they don't reach out to a school staff, they will reach out to a student. And our students will reach out to school staff and say, hey, you know, so-and-so is going through something and we think that they might be cutting or they might be suicidal. The job is that whoever the school staff is to first find out is supposed to connect with the school social worker. The school social worker will either reach out to the student and say, hey, would you love to come on Zoom? Can we talk via phone? Or do you want to come to the school building now that we are in person? And they'll do a risk assessment. We do have the virtual risk assessment. A lot of times we use the one from Columbia, but there's also some really good suicidal risk assessments where we can kind of gauge where the child is. If we believe that the child is at a place of high risk where potentially there could be harm, we find out if there's a family member in the home. If there's a family member in the home, we would ask them to work with us to call 911 or mobile crisis. And then mobile crisis will come in and support the family. If the family is refusing and we feel like there really is a high need after doing a risk assessment, then we will reach out to mobile crisis. And I just want to say, if the family does not respond, but based on what we've learned, we feel like there is a possibility, then we will still call mobile crisis. And then it's just dealing with, if the family's upset that we did it, explaining why we couldn't reach out to you and there was a concern for the student.
Okay, thank you. And another question I had was, given that like school social workers are so overwhelmed, you mentioned advocacy. So do you have any suggestions about how school social workers or even the community can advocate to have more social workers and mental health professionals in the schools? And do you think this proposed increase of social workers should be coupled with a decrease in police presence? Because I know you also work with alternative schools and things like that.
Excellent question. So we have realized over the years, and you know, I've been fortunate to be a part of some of this research, where schools that have more school safety agents and they have social workers and counselors are likely to have a higher increase of students being arrested and a higher increase of students being suspended. So the goal is right now, when you think about the 2080 model, 80% of the staff will be school safety, right? And 20% will be a school counselor, a social worker. And the goal is to actually to do the shift where you have more counselors and less of school safety, because if you have more counselors, there'll be more de-escalation, right? And that's where advocacy work comes in, where the social worker will come in and say like, no, this doesn't need to be a dean issue. Let me go in and de-escalate. Let me go and talk with this child. I actually think from how teachers are responding, teachers need more training. I think that based on my caseload, and let me show you the data, I need more support. Like, where's our social emotional curriculum to really push that children are getting the support that we need? Our schools aren't bad, but I think our schools are so focused on academics, they forget that holistic piece that we were talking about. And if we don't have time for SEL, social emotional learning curriculums, then how are our children taught to be able to naturally respond and communicate when they are upset? So these are some of the things where you would go to your principal, because your principal is going to be your main supervisor. And, you know, I'm going to say this very interesting, and I've had that experience for many years, having to deal with a supervisor who knew nothing about my role, right? And understand, like, what is a social worker? So I found many times my supervision was really trying to explain how could I support him and the staff in supporting students. And then over the years, that relationship grew. But you're going to find in the beginning, unless your school is so established, you're really going to be spending time advocating for what your role could be doing versus what your role may be doing is babysitting a child, right? And being able to say that's not my role. My role is really to support, to reduce some of these behaviors.
Thank you. And speaking of roles, a question from the chat is, does the role of a school social worker function differently in private versus public schools? And can you speak to that difference?
Absolutely. So public schools are run by the city and state. And because it's run by the city and state, budgeting is based on whatever federal dollars we get. So that will determine, do we have the money for social emotional programs? Do we have the money for 1 or 2 counselors? And you're also going to be expected to do things like mandated reporting. DASA, if you're in New York, is Dignity Act for Students. Dignity for All Students Act, where we look at the 8 protected classes, disability, gender, race, sexual orientation, and making sure that children aren't being bullied or harassed by students or staff. These are all mandates within your role. Whereas a private school, because they are a private entity, they can kind of change the dynamics. And most times in a private school, you'll find, leading to that, I saw a question there about the role of a school social worker and school psychologist. In a private school, you're more likely to have a school psychologist that will do a lot of the assessments and then support you in doing the work. In a public school, depending on the state that you are in, New York, you do have the Committee of Special Ed, and they will do it if the child is going to be evaluated for an IEP. Otherwise, there is no psychologist in the school, which means that the social worker is really the one doing the assessment and then doing the clinical work with the student and family.
Thank you. Our next question says, in becoming a school social worker, what are some tips for the interview process?
That's another excellent question. One of the first things that I would say is when you're going into the school system, you really want to talk about what are some of the interventions that you are comfortable with, like strength-based perspective, cognitive behavior therapy, solution-focused mindset, and how will you use some of these models with young people. It's always great, even if you have no experience, so you're coming straight out of college, what work have you ever done with children? And this could be children within your own home, your own children, friends of a friend, internships, but really talking about how can you utilize some of the models that you have with our young people. And I think the biggest push that most people are looking for is, how can you build a relationship between reluctant students and teachers, and really helping teachers to feel supported to be able to do their academic work. So coming in there and being able to talk about some of the interventions that you feel most comfortable with, being able to work with the school, some type of social emotional curriculum, being able to work on trainings. If you've done trainings, if you've done a paper presentation in school, you can utilize that in an interview to talk about, I've done this with adults, but this is how I could incorporate it into a school staff training.
Thank you. And I see Wendy's hand is raised. Wendy, you could unmute yourself and ask your question.
Hi, everyone. Thank you. I did my my internship this year at a large public high school here in Princeton. And I also did one last year. So I had the experience of before the pandemic and during the pandemic. And what we found, just to sort of touch on something that you were just talking about with the relationship between the social worker and the school, is we found the large majority of students that ended up being remote for whatever reason they were allowed to choose that. 70% of students chose to be remote. And one of the ways that we found was really successful in sometimes trying to find some of those students, especially the ones that were mandated, was to partner with academic support classes and other classes that student might like. So you sort of became a diplomat in a way as the social worker, because every student connected with a different adult in the building, and hopefully they connected with at least one. And so sometimes it was a football coach, sometimes it was the nurse, sometimes it was their math teacher. You know, we just had to figure out who the adult was that student was connecting with, and it didn't have to be the social worker, and it didn't have to be their guidance counselor. And that was the person that helped us get to that student. And it was really wonderful, because even though your job description said one thing, you know, everything was sort of upside down. We had to really figure out how to, you know, just connect with the kids. And so I wanted to mention that, because it's more important now than ever before. So I just wanted to add that.
Absolutely. Absolutely. You know, and you raise a great point there, because if you think about it, teachers spend the most time with students. So obviously students are going to build relationships with certain staff members, and then a social worker is coming in. It's kind of like, who are you? Maybe I've seen you around and I don't really know you, and they may not be so willing to just open up and say, this is what's going on in my life. And a lot of times social workers will use their colleagues or another student to kind of build that relationship. So absolutely, thank you for that.
Thank you. Our next question is, how much time would you say you spend in meetings, IEP meetings, and doing paperwork versus direct services? Also, do you think we should be working towards an MTSS system?
So 3 great questions. First, I would say in regards to spending time on IEPs, it really depends on how many students do you have in your school that fall under the special education services, right? If you have a large caseload of kids that are identified as SPED and are potentially going to be getting counseling, then you will find that their IEPs are yearly. So you're only going to meet one time a year per that student, unless you feel like you need to do a new evaluation to change the services. So if you only have 6 students, then that means that meeting will only happen 6 times a year. So depending on how many students you have will determine how many IEP meetings you're going to hold. And IEP meetings normally take about an hour to 2 for some of your most severe cases. And the documentation is documentation that you've been building up until that time of that meeting. So it's not like you're truly going to be doing work at that moment. Is collecting all the data that you've had over the year. Documentation though, documentation definitely is the thorn of, I think, any social worker. And you will spend a lot of time, because there truly is no time in the school day to really do your documentation. Even when I tell my social workers to put it into your schedule, somebody's always knocking the door, right? And you find that you're constantly moving. So you are going to have to be someone that is really good at making the time for documentation, because documentation will definitely pile up, especially when you have a large caseload, because you're doing their actual counseling notes. If there's a subpoena or a warrant to you, and you've got to put that data together. If there's a child welfare case, any interventions for parent-teacher conference, you've got to put that together. So I'm going to say, if I had to, there's at least 40%, 30% of your time that'll be used to documentation. And because that's so little, you'll find that you're always behind in documentation. And in regards to RTI MTSS, so what was formerly response to intervention, now multi-tier support system, we're realizing how good this tier support is, but it's not mandated. And because it's not mandated, it is up to each school to determine how they're going to use the 3 tiers of MTSS to really work with their kids. My push would be that all schools should be using MTSS, and even if all schools are not using it, social workers and counselors should be using MTSS within their systems.
Thank you. How do you engage with a teacher who's not receptive to handling so-called difficult students?
I would go back to asking the teacher, what's your goal? Because I truly believe that, anyone that's becoming teachers is because they want to see their children excel, and no one wants to have a child that does well. And, let's be honest, there are some kids that are hard to reach, right? There are some kids that are not the easiest. How can you help this child? What are some things that are getting in the way? What are some ways that we can work with you? Let's talk about your frustration, right? Some are going to find as a counselor, you may be giving therapy to your colleagues. So let's talk frustrations. Let's talk about what you're experiencing. And a lot of times you're going to hear teachers say the lack of, they've got to do lesson plans. They've got to manage 30 different personalities, and there's no time. And feeling heard many times will allow teachers to feel supported. And then it's saying, well, let's work together to create a plan. And then if this plan doesn't work, let's go back and reinvent the wheel. And a lot of times what I'll say is going more to what Wendy talked about earlier, is finding out if that student is successful in other classes. Because if that's successful in other classes, then I want to bring those staff members into the meeting to kind of, what are you doing that we can incorporate with this teacher? And sometimes that will help the teacher. Another thing that I would do with teachers is this solution focused mindset. Well, think of a time when the student was doing well. What was that like? Now that you have that in mind, how can we work towards getting that student back to that place?
Yeah, thank you. And I think that speaks to another question in the chat about like incorporating the SEL in schools and like within a curriculum to teach students and teachers how to notice their triggers and develop supports around that. Another question says, in New York, when should we start seeing DOE social worker positions open?
So we opened the market in March. And the market is open from March up until normally August 1st. After August 1st, it's really, unless a social worker leaves at the end of the year and didn't tell us, then you might have an availability. But from March to now is the time to actually go in and start to look for applications or openings. And one of the things that I would recommend to you is connecting directly with the principal. Yes, you do have to put in the application through the Department of Education, but in that you're going to see the email for the principal, and I would directly email the principal. If you don't see the principal's email, Google the school, because when you Google the school, the principal's name has to come up, and then you'll be able to email and say, hey, I saw this opening, I would love to connect with you. And one of the things that I would definitely say, especially for those within the Department of Education, New York, and then I can talk about New Jersey real quickly. In New York, it'd be really great if you go in now, right, for those that are interested in being school social workers and creating a Teach account. So if you go to New York State Teach, right, that's all caps, NYSTEACH.org. You go in and you create an account, and in that you're going to put in your transcript. You have to do a total of 3 classes, which 4 of them may actually provide the violence workshop, the mandated reporting, so that's a child abuse report workshop, and then the DASA training. You have to do all 3 of those trainings. Once you do all 3 of those trainings, you can actually put them in and you'll get a New York State provisional license. That provisional license, a lot of people don't realize this, you can get a job and later on go do your LMSW. So go do your license, right? So you don't have to wait until you have your license to apply for a job. within that year, you will have to be certified, meaning you will have to get your license, but you can get a job if you go and do the teacher count. Now, for New Jersey, it's a little bit different because New Jersey counselors are also case managers. You will have to pass the test first. Once you've passed the test, then you will be able to apply to the Department of Education, as well as reach out to local schools to see if they have openings. And I think it's fine if you have a school of interest, if you reach out and introduce yourself and say, hey, do you have an opening? In New Jersey, you do not have to do the provisional license. You just need to be certified, which means get your license. Looking to see if there's any other questions. Oh, Shadiq's back. Okay.
Oh yeah, there was a question about are social workers who work as school social workers right after graduation able to get clinically supervised hours to sit for their LCSW, and if there's only one social worker in your school, who would do that supervision?
That is actually a very great question. And what I will say to you is this is also where it depends on if you're going to be working at a private school or a public school. Private schools, 9 out of 10 do not have clinical supervisors, but some private schools, and this, once again, you're going to have to advocate, will pay for you to get your clinical supervision outside, right? Charter schools within both New York State and New Jersey, a lot of times, because they don't have a direct supervisor over social workers, normally your principal, will also pay for an outside clinical supervisor to come into the school or for you to meet them virtually and get your hours. DOE does not provide clinical supervision. Most times, a DOE social worker will have to go out on their own and find clinical supervision. You may get a stipend, you may not. It really depends on your principal's budget and whether or not they are willing to go that route. But a lot of times, a DOE counselor gets a part-time job at one of those fee-for-service agencies. They get some extra money, and then they also get their clinical license. I do hope that that's something that will change in a few years as more and more schools start to acknowledge the LCSW. And I'll explain why we do that. You do not need to have an LCSW to stay in the school system, right? Once you have your LMSW or your LCS or your LCW in New Jersey, you are completely fine to work. So for those reasons, many schools don't push forth in saying, we're going to have someone to provide that clinical supervision. What is the work schedule for a school social worker? It also depends. A DOE school, normally it is, I'm going to say at 8 to 4. You probably will end somewhere between that 3 to 3:30. But I think to be honest, 8 to 4. Private schools, it depends on the hours of that particular private school. And then charter schools, I'm going to chunk it to 7:30 to about 4:30. So charter schools definitely have longer hours because their students are in the school longer.
And another question is, you've mentioned there seems to be a discrepancy in a teacher's utilization of trauma-informed lens versus a social worker's utilization. Does this also exist with the pillar of cultural competency? Are there some schools more equipped in responding to students with
that actually is another great question. If I was to answer this 2 years ago, I would say that cultural competency and trauma-informed was just not something happening in schools. If it was because you either had an administrator who really understood the two concepts or a veteran staff member, because it didn't always have to be a social worker who understood it and pushed forward for it. I think with this pandemic, and even prior to this pandemic, with just suicides as a high, people were starting to talk about trauma-informed, and now you have many schools creating what we call trauma-sensitive schools. And trauma-sensitive schools mean that all staff members, down to the nurse, are trained in understanding trauma informed and being able to put on those trauma glasses. So I think more and more schools are really doing better in terms of being trauma informed and making sure that there isn't a discrepancy, but it's brand new within the last 5 years. So even though trauma informed has been within our field for more than 10 years, it is still very new to the education system. Cultural competency, now the whole world wants to be DEI, right? So because the whole world wants to be DEI, you're starting to find that schools are starting to look at our curriculum, so are our textbooks culturally competent, right? Are the lessons that our teachers providing culturally competent? How we hiring, is that culturally competent? So the culturally competence is not a social work lens. I think schools are looking at it holistically, so the entire school. It just so happens many times social workers are already familiar with cultural competency, but when schools look at it, they're not thinking from a social work lens, they're thinking holistically.
Thank you. And another follow-up, and I think this would be the last question. Do MSW students need to have a field placement in a school in their specialist year to be considered for a school social work position after graduation? And like, how competitive is it to get a school social work job, and what degree is the specialist year field placement a factor in making you a competitive candidate?
So you do not need to have a field placement in a school to get a job as a school social worker. You will have to have field placement experience, but that's a mandate for all of our school social work master's degree program. So you already cover that just having an internship in general. It is a very competitive field, and it's a competitive field because, like I said before, at this moment, most schools only have 1 to 2 counselors. So unless a social worker is leaving or they're opening up another slot, many times there aren't schools that have openings. And what will put you at the top is not necessarily field placement experience, but do I have any experience working with children, right? It doesn't necessarily have to be in your field, but if you can talk about experience that you've had with children or interventions that you've used with adults, and you can elaborately explain how you can utilize that with children, you'll be very competitive.
Thank you so much, Professor Wilson, for coming. This has definitely been like just really fun for me to learn about, because I think I I really didn't know too much about school social work, and you cover a lot.
Thank
So
you.
again, thank you. All right, thank you, everyone.
Thank you, everyone. Nice meeting you.